Tinnitus and ear fullness can be serious and lead to long-term anxiety if left untreated. Now, fortunately, tinnitus and ear fullness are two of the most popular problems that I help people with. You see, when the top bone in the neck misaligns the atlas vertebra, that vestibular nucleus gets compromised. Now, the vestibular nucleus is a specific part in your brain that controls the ears and your hearing. So, if your vestibular nucleus is compromised by that atlas misalignment, do you think your brain will have a hard time figuring out how to regulate a certain tone or pitch? Absolutely. Now, this is why when you hear a loud noise, your brain processes that noise and has a hard time regulating the pitch. Now, this is not good and definitely needs to be addressed. Now, with ear fullness, when that atlas misaligns, you'll also get a backup of cerebrospinal fluid, or CSF fluid. Now, when you have this backup, this can compound that pressure buildup, making the tinnitus worse. Because if CSF flow is being choked off from a misalignment, do you think the brain and the ear will be able to function properly? No way. Unfortunately though, most doctors want to hit the snooze button and throw out your body's internal fire alarm by prescribing medication, which is never a long-term solution. You know why? Because you'll never fix a structural problem with a chemical solution. You need to get to the root of what's actually causing the problem, and that's where I specialize, providing that structural solution. As a NUCCA upper cervical chiropractor, the first thing that I need to do is take specific x-rays of your atlas to see if it's misaligned. Now, I have advanced spinal software that allows me to measure your atlas down to 1/100th of a degree, which is critical when it comes to actually realigning it. Now, these x-rays are the most important thing that I can do for you as a NUCCA doctor. Now, after I measure the exact position of your atlas, then I'll be able to correct it. Now, the realignment is so gentle that anyone would feel comfortable with the amount of pressure that I use. Gentle, slow, sustained pressure for about 30 seconds right below the earlobe, and that's all that's needed. There is no twisting, popping, cracking of the neck. Then after that, we will definitely want to retrain your neck muscles for a few months, realigning you as needed to make sure that you stabilize to get those long-term results. But other than that, that's pretty much it. So if you're curious to see if your atlas is misaligned, make sure to schedule an appointment with a NUCCA doctor near you as soon as possible to see if you're the right fit for treatment. Have a great day.